The UN Special Coordinator for the Middle East, Sigrid Kaag, came to the Security Council to demand the UN be allowed to resume aid operations in Gaza, as Israel's ambassador attempted to deflect blame for the suffering.
Well, we are not bombing the people of Gaza. We are fighting a terrorist organization.
An American trauma surgeon conveyed the despair he saw in Gaza, saying he did not treat a single combatant while volunteering in Khan Yunis.
My patients were 6-year-olds with shrapnels in their heart and bullets in their brains, and pregnant women whose pelvises had been obliterated and their fetuses cut in two while still in the womb.
Children are dying of starvation. The images of mothers embracing their motionless bodies.
Palestine's ambassador broke down when describing the crisis, calling it an attempt to convince the people of Gaza they have no choice but to leave if they want to live.
How could anyone?
Most council members, including Europeans who have staunchly backed Israel's right to defend itself, called for de-escalation and more aid to flow through UN channels.
The UN has a clear plan to deliver life-saving aid at scale. It contains robust mitigations against aid diversion.
The United States, represented by a low-level diplomat, was the only country to express support for the new Gaza Humanitarian Foundation, set up by the U.S. and Israel. But Kaag said attempts to circumvent the UN will set a dangerous precedent.
I think the privatization of aid and the weaponization of aid is a very dangerous precedent. It doesn't only speak to the situation potentially in Gaza, but worldwide.
UN experts and many member states have described what is currently happening in Gaza under the new aid delivery system as collective punishment, forcible displacement, and the weaponization of aid, all of which are illegal under international law. Kristen, Saloomey, Al Jazeera, the United Nations.
Well, we heard there some of trauma surgeon Dr. Feroze Sidhwa's compelling testimony before the UN Security Council in Kristen's report. He joins us now from New York. We very much appreciate you talking to us. You have experienced this firsthand. So just how horrific is the situation in Gaza at the moment across the medical facilities that are remaining?
Well, the medical facilities that are remaining are very few. Nasser Hospital, where I worked in March, is really the only hospital that's functioning in any serious way. The rest are basically just buildings that doctors happen to be inside, but they're not really doing anything in terms of medical care. And even at Nasser, and even when I was there, which is 2 months ago at this point, the only care that we could really provide was, like, I'm a trauma surgeon, so I could stop people from bleeding to death. That requires very basic instruments and supplies, but there's no reconstructive options available. Infection is a huge problem. Antibiotics aren't available. Blood isn't available, and the reconstruction of children, of their limbs, if they have a traumatic brain injury, if they have a spinal cord injury, these reconstructions, they need fairly sophisticated equipment. It's not equipment that's not found in third world countries, in third world hospitals. It is. But it's not available in Gaza because of the blockade, and not just the blockade since March 2nd, but the blockade going, back to 2007, honestly. So it's the Gaza's healthcare system, for all intents and purposes, it really doesn't exist anymore. The Palestinian physicians and nurses, they're doing absolutely everything they can to keep it functioning at whatever level they can, but there's not much they can do anymore.
You mentioned the Palestinian medical staff there. I mean, they themselves have been widely targeted, haven't they?
Yes, more so than in any other conflict that I am aware of, not just really in the history of the world. The rate of, if you adjust for the size of the population, because Ukraine is a much bigger place than Gaza, obviously, if you adjust for the size of the population, the rate of killing of healthcare workers in Gaza is 143 times higher than it is in Ukraine. That's outrageous. I mean, it's just, there's nothing even remotely like the dire Gaza's healthcare system going on anywhere else in the world right now. And it's right before our eyes. It's not hidden at all.
You mentioned the dire shortage of medical supplies and equipment. How does that impact on what can and can't be done for those in desperate need?
Yeah, I mean, like I said, I can stop me or somebody like me, a trauma surgeon can stop someone from bleeding to death in that situation. But again, that's a very minimal level of care. That just means you don't bleed to death. But the ability to stop someone from dying of infectious complications after surgery, the ability to birth a baby safely, the ability to treat a child's asthma attack, none of this exists. It just literally none of it exists. I mean, you might find it in one person might be able to access it somewhere, but at the scale that's actually needed in the Gaza Strip right now, which is tremendous level of wounding of this population, it's just not available. And so it makes it impossible to provide life-saving medical care. And again, I don't mean anything particularly fancy. I mean, you could go to like when I was in Burkina Faso, the flagship hospital there in Ouagadougou, it had the ability to do all of these things. And Burkina Faso is one of the poorest countries in the world. So it's not a matter of the country being rich or poor. It's a matter of access. And there is no access because the U.S. and Israel are blocking it.
Israel has consistently claimed it's targeting fighters and military infrastructure. But what did you see when it comes to those needing treatment? Was it mainly women and children and non-combatants?
I never, like I mentioned during my UN testimony earlier today, I never once saw a combatant in the Gaza Strip. Literally never once in the hospital. That is, but it's important for people to realize I'm just one guy. Maybe I didn't see them. Maybe I'm an idiot. Who knows, right? There's all sorts of possibilities. How is it that no one has ever seen a combatant in a hospital in Gaza? The 99 American healthcare workers, including me, signed a letter to Joe Biden last year in which we explicitly said not one of us has ever seen anything like militarization of a hospital in Gaza. It's just not happening. And furthermore, I just want to be clear, even if it did happen, suppose Hamas hid some weapons behind an MRI machine, or suppose they, whatever else, some momentary minor thing. How could that possibly justify destroying an entire hospital or blowing up an entire? Like I'll give you an example. On March 23rd, I was at I was at Nasser working, and one of my patients' rooms was blown up by an Israeli drone, most likely by an Israeli drone strike. And the Israelis didn't hide it. They were very proud of it. They said they did it to assassinate a man named Ismail Barhoum, who is he was the prime minister of Gaza, at least according to them. Well, just turn the situation around. Can Hamas bomb a hospital to kill Benjamin Netanyahu? No, that's insane. Nobody accepts that at all. So even if what Israel claims they're doing is true, it's still an absolute outrage. And that's why the UN Security Council members today said, and as everybody knows, it's not just Israel, what Israel and the United States are doing in Gaza is destroying the foundations of international law. And that's terrifying.
You mentioned the Security Council there. We saw some of your stark address to them. What is your feeling over how your speech was received?
I don't think anybody at the Security Council doesn't know the information I gave. I mean, maybe the presentation was a little bit different than they're used to. I'm told some of the council members were tearing up during it. I didn't notice that myself, but that's what friends have told me. But I think everybody who wants to know what is happening in Gaza is well aware of what's happening in Gaza. Maybe you don't know the gritty details about a pregnant woman's pelvis being destroyed or a child being ripped in two, but you know it's bad. You know that the violence is totally unjustified. But at the end of the day, whether or not to stop it is simply a political decision that only the United States of America can make. The UN Security Council can do anything it likes. The U.S. has a veto. And if the U.S. decides to use that veto, or if it decides to ignore Security Council resolutions, then the slaughter will continue. It's a decision that the American people, who are strongly opposed to what's going on, have to impose on their government so that it starts listening to public opinion on this matter.
Let me ask you this. You are a professional in your field, but to what extent, on a human level, does your experience in Gaza haunt you?
Me personally, I've been very lucky in that regard. I don't personally have intrusive remembering or anything like that. What haunts me, or in other words, I don't have like the typical PTSD symptoms, which I'm very grateful for. But what haunts me is the fact that I'm responsible for it. Yes, I went there and I helped people. That's fine, but it's my money that's fueling this. It's my weapons. It's my diplomatic support at the United Nations, because I live in a democratic country. And that means the citizens of the country are responsible for what the government is doing. We don't want it to be doing the things that it is, but we haven't imposed our will on the government, and that's what haunts me. I'm used to seeing death and destruction and despair. I've worked in plenty of war zones. I've worked in Ukraine. I've worked in Zimbabwe. I've worked in, like I said, Burkina Faso. I've worked in Haiti, and I've worked in Palestine before, in the West Bank. And this was my second trip to Gaza. What bothers me is not the blood and the mayhem. It's the fact that I'm responsible for it. I'm the one doing it, and so are the rest of my fellow countrymen. And we just don't have to be. We should not be in a situation where the United States government is just free to ignore the will of the large majority of American people. That's outrageous. What does democracy mean in that case?
Dr. Feroze Sidhwa, thank you very much indeed for joining us here on Al Jazeera.
Thank you.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.